and I'm joined by the fabulous Dr. Dupe. And today we're here to talk to you about sexual and reproductive health. So let me just say a little bit about myself. I'm Danae. I'm an Oxford-based doctor working in emergency medicine with a background in public health, and I'm a member of the British Association for Sexual Health and HIV. I also co-founded and am the CEO of Yoxly, which is a medtech venture that's on a mission to simplify, normalize, and destigmatize sexual health by providing a range of remote services through an integrated online ecosystem that's designed to give users a personalized experience with more convenience, privacy, accessibility, and control. Dupe, did you want to introduce yourself?
Yes. Firstly, thank you for having me. I'm Dupe. I am the founder of Bloomful. Prior to Bloomful, I was a management consultant. I worked at a company called BCG, doing strategy work for healthcare companies, a lot of work for the NHS. And before that, I was also a doctor. So I haven't done any clinical medicine for a while, but I trained in London at medical school, and I worked as a medical registrar in London hospitals for around 7 years altogether. Now I am building Bloomful. Bloomful is a tech-based platform which is on a mission to change the way that we assess, manage, and diagnose women's gynecological health. And we are doing that by essentially building a better way to connect women, clinicians, and medical data globally. So super exciting journey, and yeah, really excited to have this conversation with you.
Awesome. Well, that's fantastic. So I figured, we're trying to cover quite a lot. So, but we're two female physicians, two founders, hopefully two friends, who have started companies in the sexual health and reproductive health sector. So I just thought maybe we could talk about it for a little bit. So kind of generally, what is sexual and reproductive health? And I know when you go to medical school, the World Health Organization gives kind of a standard definition, don't they? Where it is actually not just the absence of disease, but it's a state of complete physical, mental, and emotional well-being in regards to somebody's, sexual and reproductive wellness. Did you want to add anything on to that?
I think that's just a really great definition, because unlike other parts of medicine, which are very kind of focused around the pathology, I think when it comes to sexual health and reproductive health, it really has to encompass the whole person. And I don't typically like the word holistic, but it is really about the balance between yourself, any kind of pathology or medical condition that you might have, and how that makes you feel, and also the environment that you're in. I think it's an area that has a level of vulnerability attached to it, unlike other parts of medicine. And there are so many additional barriers that are associated with reproductive health, with sexual health. But I think it's just really important to have a kind of a really broad view of what the definition there is. So yeah, it's their definition at the WHO is really interesting.
So do we want to talk a little bit about how sexual health and reproductive health are related, right? Because a lot of times they involve the same organs or organ systems, but they're not always necessarily the same. But the two of them need to kind of work together to really give people, I guess, a complete state of complete well-being. So a lot of times when people think about sexual health, it is for the purposes of reproduction, but not always. And so, impacts on people's sexual health. So for example, undiagnosed or untreated, STIs, or difficulty achieving intimacy with a partner, that can obviously affect their reproductive health and wellness.
Yeah, definitely. I think they are intrinsically linked. Like you say, they obviously involve the same organs, the same organ systems. But I think you can't, often one impacts the other. And I think that's where you'll never be able to completely separate the two. But I also think from sort of the societal level and, the kind of how we view them also links them together intrinsically. Obviously, intimate areas always have, or at this point still have, a level of taboo around them. And so how we talk about sexual health, how we talk about reproductive health is often shrouded in that still, which is unfortunate, because that's what creates many of the barriers to accessing the right care at the right time and feeling like you can approach the right person to help you, with concerns in that area. So I think that's something that they'll always have in common, and that's something that definitely links them.
Yeah, no, I completely agree. I think the stigma and that still kind of shrouds, sorry, that was my dog. The stigma that kind of shrouds that still kind of surrounds the topic. Is one of the biggest challenges we have to getting people to access services. But we can touch on that a little bit later. So we know that, sexual and reproductive health are important. But I also kind of want to say that people are sexual throughout their entire lives. So a lot of times I think that sexual and reproductive health care is focused predominantly on people who are of reproductive age, but actually, humans are sexual beings and they actually have needs that extend, far into later decades of their life. And so there has to be a way that we can kind of help people achieve satisfying, responsible, and safe sex that's outside just their capability to have freedom, and kind of empower people to decide if they want to have children, and then if so, how often.
Yeah, I think that's a really interesting journey. And similarly, within reproductive health, women in particular, I should say, have such a sort of profound lifelong journey as far as their gynecological health goes, their reproductive health goes. If we going from first period all the way through to family planning, menopause, and beyond, there's so much in between as well, whether that be fertility, miscarriage, perimenopause. There are so many kind of blocks of time within our journeys with this area of our health that I think it's really important not to snapshot one, or a couple of decades as being the important decades. There's support that is needed throughout our sort of life, really, in both sexual health and reproductive health. So yeah, that's super important. And I think that journey can be packed with emotion. It can affect your well-being, your ability to work, sexual health too, it can have economic impacts on you. It can affect just your quality of life in general, your health-related quality of life especially. So I think super important to just look at a whole person and acknowledge that it's not just your 20s or your 30s that are important. It's everything from, your early teens through to potentially the end of life that can be affected by this.
If we know that sexual and reproductive health are so important, why is it that we think people aren't talking about it enough? I know we mentioned the taboo, and I see, at least from where I sit, when it comes to sexual health, I see two main challenges. I see people who struggle to access services, right, because either they're embarrassed or they don't have the time to get to a clinic. And then I see people who don't even know they need to access services. And that's an education piece, which is actually one of the bigger challenges that I think we face in trying to tackle some of the issues that surround sexual health. Have you found it to be similar for reproductive health?
Absolutely. I think education especially. I speak to women every day. I have one-to-ones with our customers daily. And the thing that always comes out, the common denominator is always around, not knowing enough about our bodies on a fundamental level, what our anatomy is, what it's supposed to look like or not, what our internal anatomy looks like, and therefore being able to understand deviations from the norm. And I think that is such a problem. I went to an all-girls school here in the UK, and you would have thought that it would be a priority to make sure that we had a really strong understanding. But I can't say that it was sort of a thorough educational piece around menstruation and hormones and different pathologies that can come up and sexual diseases. And I think that's something that needs to change, like on a governmental level or whatever. I think we need to start taking education in this area much more seriously and being just a lot more thorough about it from a really, really young age. And I think that would help trickle forward into our adult lives and just empower men and women to understand more about what's going on with their bodies and be able to access the right care. I think that's probably the number one piece around why this is such an issue still.
Yeah, no, I completely agree. I think when it comes to, again, and I know we mentioned the stigma and some of the shame surrounding it, but I think there's even a reluctance to ask questions. A lot of times people are embarrassed to even bring it up to their clinician. Do you know what I mean? And so I think there's so much variation when it comes to the human body. And you're right.
Yeah.
So I also went to an all-girls school. And while they did cover, you know, in a perfunctory way, menstruation and conception, it wasn't necessarily practical advice that I think a lot of girls at that age could use. You know, what is the difference between certain types of vaginal discharge? What is the difference between different types of contraception? You know, and I think the trying to shy away from those topics in school, or the reluctance to address those things in young people. I mean, we end up with people who are then older and later in life, and they have never had a proper sex education, which is, you know, can be really challenging when you're trying to kind of backdate 4 decades to kind of give somebody a basic education.
Absolutely. I think when you put it like that, you know, you can basically go through your whole life without ever being really taught this stuff. And I think, you know, obviously there are lots of parts of medicine which you can get away with not teaching people about. That's what doctors are there for. But this is such an intimate area that has such a far-reaching effect on your life that I think it's important for us all to know. But I think another important element is also just the lack of research on the medical side. And particularly, I don't know that much about from the sexual health side, and it'd be really great to hear that from you. But from the women's health side especially, we know that less than 2.5% of publicly funded research goes into that area. And you know, I went to medical school, you went to medical school. Not a huge amount of time was spent learning about gynecological health, you know, sexual health. Obviously, we do have time, you know, touching on it. But I would say, considering how many women are affected by it and men over the course of their lives, I would have thought that we would, proportionally, we should know more. And I know that GPs can definitely become GPs without having spent much time at all in this area. So I think that's a real issue. That's the lack of research and how that should be forward to medical knowledge on the ground, and therefore women's and men's experience of that. And, you know, often the dismissal and the kind of minimizing of symptoms and pain and things like that really boils down to doctors not really knowing, I believe. They oftentimes just don't really know, and that has a really negative impact on the healthcare journey for men and women in this area. So, yeah, I think that lack of research needs to change, and we need to start being much more thorough around, from the kind of therapeutic perspective, what is available and how much are we investing really in this area and understanding this area.
Yeah, I couldn't agree more. I mean, we all know that there's a bit of a gender gap when it comes to medical research and medical funding. And I think, and hopefully that's starting to change. I think probably since we graduated from medical school, not to date us, probably since we graduated, it's starting to shift. But we're still decades behind, aren't we? So really, it sounds like the challenges and some of the barriers that we talked about that surround sexual and reproductive health are kind of what drove us to set up our respective companies. And I feel like as women, as physicians, we see the need for change. And I think sometimes it can be really hard to action that in a really large kind of government-run system. You know, not because there's not a desire for change, but just because being able to be agile and act quickly can be challenging in any organization that's big. So can I ask a little bit about what is it that specifically that drove you to create Bloomful?
Yeah, absolutely. And I think what you've highlighted there is the truth, and it's the reason why, sadly, our NHS is, not as progressive as it could be. It's a huge organisation. There are millions of barriers in place for tech to really come in and make a change. But I think, in essence, that's really what drove me to want to break down that barrier and build something that could help. So for me as a doctor, and it feels like such a long time ago now that I was on the shop floor, but I would see women coming in, daily with these problems: pelvic pain, heavy bleeding, menopausal symptoms that were having a really profound effect on their lives, ability to work, like I said, quality of life. I would meet women, particularly in GP, that as working in practice, who would be planning their leisure activities, their holidays, their whole lives, sometimes around their reproductive health. Dropping out of university, leaving work, and to me, I would see women like this and just think, that's absurd. When you look at conditions like diabetes, for example, there is such a structured pathway in place to get those patients diagnosed quickly and efficiently. And, you only need 1 or 2 visits really to get to grips with that diagnosis and to understand what's going on. And, you know, why were these women suffering in the way that they were? You know, I think on a broader scale, it's a really multi-layered problem. We've already touched on lots of the issues that play in, but historically a lack of research in medical school, just a lack of education and in primary care. And then also you have fundamentally kind of societal reasons why women are often dismissed and minimized. And then you've also got an underfunded and under-resourced NHS. So I think all of those things play into the problem. And I could recognize that, and I knew that I wanted to build something in that space, but I knew that I needed to do something personally. I needed to wash clinical medicine off me a little bit, and have some experience in business and the strategy and how to start actually doing that, because I had no idea what the solution would look like. And that's one of the reasons why I went into consulting. And it just gave me the opportunity to just understand how to build hypotheses, how to prove and disprove them, you know, how to put a stake in the ground, how organizations come together and sort of, you know, interlink, and where I could position myself to build something in the space. And I took the jump a couple of years ago. I think COVID was a real push for me. There was a lot of discussion around that time around inequality and how COVID was affecting women and men differently. Even the race discussion that in 2020, it all pushed me towards thinking, you know, now's the time to actually build something in the space and take the plunge. And I suppose, yeah, that's why I did it. I feel really strongly that somebody has to start building in these spaces. I'm really glad that women are finding their voice, and there is almost an uprising in demanding services and products that are catering towards women, built around women. And I think companies like Bloomful, we're really kind of verticalizing into that and building around different particular demographics and particular profiles. And it's really exciting to see. I believe I have a really unique lens, being clinical, having a business strategy background, being a woman, a Black woman at that. You know, I feel like I have that kind of triple aspect viewpoint that enables me to really be able to see the problem from a number of different perspectives. And I think that's going to serve us well as we grow.
No, I think that's fantastic. I love what you guys are building at Bloomful. And looking, I mean, I can think of people, not just like clinically, like in terms of patients, but I can think of people that I know personally as well who could benefit from the service. So anytime you look at something, you think, oh, this would have made life so much easier. Why didn't we have this? You know what I mean? When I saw that case, or when I spoke to, you know, this friend, I think it's a testament to what you're building. And I think it's absolutely fantastic. And I think something has to change, right? Like what we're doing isn't working. I think that's evidenced by the fact that, you know, all the studies that are coming out that talk about some of the reproductive health disparities, you know, in women versus men, the rising STI rates, you know, this lack of education. So I think there's evidence to suggest that, you know, what we're doing isn't working, and it's time to try something new. So I think that's fantastic. Yeah, I think when it
about how you built Yoxly and why, and you know what the motivations are there.
Oh my gosh. So, I mean, when I think about Yoxly, I've probably been kind of ruminating on something in the concept for about a decade. So, you know, I have a background. Yeah, I know. It wasn't at the forefront of my mind. It was just kind of somewhere in the back simmering. But, you know, I've got a background in public health, and I had written my master's thesis on the health disparities and resiliencies in Philadelphia's transgender community in the inner city. And this was, not to date myself, but this was 2009. So it's been a while, and it's been incredible to see the journey that kind of, you know, that I guess transgender rights and kind of awareness has taken. But when I was doing that, I realized here was a group of people who were incredibly good at having open and honest conversations about their sexual and reproductive health needs, oftentimes because their needs weren't being met by traditional medical practice. And so they were educating their providers a lot of the time. They had to be their own advocates. And so I thought, well, you know, here's a group of people doing a brilliant job. This is something that we could actually learn from. And then as I kind of worked in medicine in different countries, you know, for a number of years, I realized that everywhere I went, sexual health care was quite fragmented. Nowhere seemed to really do it super well. There were always these awkward taboos, and it was still, you know, where people got, tested, didn't necessarily line up with therapy or treatment. And so while there have been, I think, vast improvements in the way that we deliver sexual health care, in the same way that kind of you saw the pandemic and the effect that it had on people's ability to access services, I saw as well. And so the ability to offer remote services for sexual health care, I think COVID kind of ushered in that trend, but I think that trend is here to stay, because when it comes to sexual and reproductive health, there is a degree of anonymity that some people want to retain. So there are some people who don't mind going into a clinic or having a face-to-face conversation with a provider, but there are others who would choose to be a bit more private and to do things in the comfort of their own home and reach out to a professional if and when they feel they have a question. And so it's about, again, it kind of goes back to the tenets that I built Yoxly on, but it's convenience, privacy, accessibility, and control. And I think what we're trying to do at Yoxly is we're trying to enhance education efforts and then improve access to services, ultimately, so we can empower individuals to take more of a proactive than a reactive approach. Because I feel like in healthcare, we are often so reactive. We wait until there's a problem, before we say, oh, wait a minute, there's something we should be doing about this. And I think just to tackle one aspect of that, so just to say, well, we're going to focus on, testing, and then we're going to focus on treatment, it's not enough, because if you don't educate people, they're not going to know that they need testing and treatment. And if you don't make it easy for people to get tested and treated, you're just creating more barriers, more roadblocks for them. So I think it has to be this really well integrated and holistic approach, and a realistic approach as well. I think often, like at least when I was in school, they talked a lot about abstinence and how that is the way to prevent an STI. But, well, that is one way of preventing sexually transmitted infections. There are a host of other ways as well. And I think by ignoring or, not speaking about some of the other things that have happened, or some of the other, I guess, preventative methods or, just practical tips that people can take, I think we're doing them really a disservice.
Yeah, absolutely. So cool what you guys are doing. Super awesome. And I think your pillars are great. The control aspect, I think people want, the accessibility people need, and education and stuff is like the foundation, I think, of all of this, essentially. And similarly, we're trying to build that central source of truth for people to understand what's going on with their bodies, and to be able to find moderated and accurate information around these topics. So it's like you say, they know when they need treatment, they know when they need intervention. So yeah, super exciting. There's so many parallels between what we're doing.
Was there anything else specifically that you thought was important when it comes to the topic, or anything that you particularly wanted to touch on, whether it was about starting your own company or the subject of sexual and reproductive health?
I think just one other thing that we haven't talked about is like normalizing the conversation, which I think, apart from like the education piece, is the other big pillar towards moving things forward in this area in general. I think so, for example, if you think about the workplace, like especially where reproductive health goes, and the fact that workplaces become so much more gender neutral, and we've seen so much more diversity in business and things, that we now need to, I think, start actually thinking about or recognizing the importance of supporting women in the workplace around their reproductive health, around their sexual health, because we know that they are affected by certain things in very, very different ways to men. And I think that's just something, education is one thing of consumers, of people, but I think if we look at other big areas of our lives, like work, I think there also needs to be a lot of reform around that as well. And how can we support people to access the right sexual health care in a work setting, or the right reproductive health care in a work setting? How can we adjust policies or bring in new policies to support women that are going through menopause, for example? And, we know that there are such interesting statistics around menopausal symptoms and how they affect women's ability to work, and, miscarriage, for example, and how they emotionally affect women's ability to stay in a particular position. So I think that's just another area that I'm quite passionate about investigating as Bloomful grows, in terms of how we can use our platform to support workplaces in supporting their employees, essentially. And yeah, I don't know how Yoxly is, whether you have a viewpoint on that, and whether you have longer term sights to sort of tackle the same issue.
Yeah, I think when it comes to let's say poor sexual health, or people who are suffering with sexual health or reproductive health issues, I think it ends up taking a toll on the individual in terms of their quality of life. It takes a toll on the healthcare system in terms, I guess, in the sense that they spend hundreds of thousands of pounds managing late stage complications of very preventable, illnesses, because of undiagnosed and untreated conditions, or mismanaged or poorly managed conditions. Let's say there's also a toll on the economy. So, like you said, people not being able to go into work, so we're losing productivity. So, it is in the best interest of everyone, meaning governments and employers and individuals, to kind of normalize that conversation and to recognize how improving people's sexual and reproductive health and wellness actually, if they're not going to do it for the reasons of, okay, they want to keep their employees happy and healthy, or they just want to do the right things for themselves, from a purely financial perspective, I mean, it makes sense. But again, I think in healthcare specifically, I think we spend a lot of time on tertiary stages of illness, and we don't spend enough time on preventative care. But yeah, I completely agree. I think when we start to look at the effects of sexual and reproductive health on the individual, and not just in their personal and private lives, but how that spills over into their professional lives, I think that it's something that we all need to do a bit better. Because the reality is that there's no more one size fits all either. And I think, what works for one person isn't going to work for all people. And so taking more of an individualized approach starts with recognizing the differences and how people experience pain differently, or how they experience, certain conditions, or, they go through different healthcare experiences differently, and how that has an effect on their personal and their professional life.
Yeah, absolutely. I think from a business sense, obviously you've got to find a way to build some standardization into that. And maybe that's the challenge. How do you take a personalized approach whilst also kind of, not losing money, or, not doing things that are unsustainable, I suppose, from a business sense. So yeah, it's a really interesting challenge. And I think that's where companies like Yoxly and like Bloomful will come in really handy as time goes on, because we're building the standardization into the process in some way. We're building a pathway that works and the customer journey that works, and then we can start to broaden that and scale that and help huge numbers of women or men across the world to access the right care at the right time. So yeah, super exciting times ahead for sure.
Yeah, what I love about, I think, what Yoxly and Bloomful are trying to create, I think what we do is we leverage a lot of the technology that's come in over, in reality, decades, that I think often COVID has kind of ushered into the medical sphere much more quickly, but oftentimes that I think clinicians, we don't always utilize to the best of their potential. And so you see all these advancements being made with, finance and, remote meetings. And you think about, well, how can we somehow adapt that to safely and securely and reliably, help patients who we may struggle to access. And we have to think about also how that frees up resources. So not just in terms of, financial resource, but also in terms of time for clinicians and for individuals who may have more complex care needs to attend those kind of in-person appointments. But it just allows us to be so much more efficient and to expand and broaden our reach and help so many more people than if we were just operating in person on a patient-by-patient basis in a standard clinic.
Yeah, and I think COVID, like you said, has been really good for helping people, consumers, patients to understand that healthcare, for the most part, can be delivered virtually. A great standard of care can be delivered virtually. Now, of course, that doesn't negate the need for in-person care. I think we've still got a way to go before we can say that all medicine can be delivered virtually. But I think COVID has definitely pushed us forward quite a few steps in that regard, and we need to sort of take that and run with it, essentially, and continue to build products that can, build on that. I also think I had another thought in mind, which I've now forgotten, but I think it will come to me. Yeah, I think you're absolutely right, though. It's about taking the current situation and thinking about how we can capitalize on that, essentially, and continue to scale patient care in a positive way using the tools that we now have available to us and that people are now accepting much more readily. Actually, for example, oh yeah, I remembered my point. I do think that we do still need to think about some of the downside to that though, and how businesses like ours can sort of mitigate that. So for example, these are very sensitive topics that we talk to patients about, and it's sensitive information, and how can we help people to continue to feel secure through a screen? You know, how can we, I don't know, help people to feel like we are taking a really personalized approach and we really understand them and emotionally are with them when, you know, we are essentially cutting out the in-person element of care. So I think there are still challenges there, but I think those are definitely surmountable challenges that as businesses we're constantly trying to figure out and work out.
Definitely. No, absolutely. I think that is one of the biggest, I don't want to say concerns, but it is a bit of a fear, isn't it? You know, when you lay eyes on someone in person and you perform a physical exam, you know, it sheds so much light on a diagnosis, or on, you know, it helps you create a treatment pathway. And so when you're doing a lot of these things remotely, you're right, it's about being safe. And how much of that can we do remotely? How can we scale that safely? But then I think the answer to that is just, as we get more data and as tech gets better and as, you know, we get more experience, we can continue to refine, you know, I don't want to call them necessarily algorithms. We continue to refine a lot of the information that we get. And I think safety netting is key. So I know at Yoxly, I'm sure at Bloomful, you know, we safety net quite heavily, which basically means that, you know, if there's anything that we think is concerning, or if there's anything we think shouldn't be managed, you know, remotely, and actually it requires an in-person visit or an in-person appointment, we always make sure to encourage people to access those services in person. Because, you know, it's, while we want to help a number of people, we recognize, especially in these early stages, that we're not able to provide a complete service, at least not yet. And so by being, I suppose, by signposting people and by being that first point of contact to let them know what the next steps are or what the next steps they should take be, I think it's still really important, but I think it is imperative that we kind of recognize and work within the limits of the care that we can deliver remotely.
Yeah, absolutely. Couldn't agree more. So well put. And like you say, it's something that we're also building into our process at Bloomful. You know, how do you make sure that you apply so many filters and sort of, you know, methods of ensuring that nobody falls through the cracks, that we capture everything that we need to and maintain a safe service. I think that's super important. And I think doctors in general are very driven towards that. You know, we're very safety conscious. We're very, you know, there's GMC rules and, you know, the Medical Defence Union, all of that is like so drummed into our way of working that I think it would be difficult to not have that as a primary concern when you're building a digital health product.
No, absolutely. And I think that's something that, again, as clinicians, it's a unique perspective because you've been there, right? So we know what it feels like to worry about an individual or to see a result, or, you know, to say, actually, I'd be more comfortable if this person was seen by a professional, you know, not in 2 months' time, but actually within 2 weeks. I think these are challenges that we'll be able to surmount, but I agree. I think at least in the initial stages, it's about delivering care safely and just staying consumer centric. So I know we have consumers, you know, I don't always refer to our users, our Yoxly users, as patients, but at the end of the day, that they're people, and they're people with a specific need that we're trying to fill. And one of my favorite things about building Yoxly is actually interacting with those consumers and knowing what they loved about the service, if there was something they didn't like about the service, and how we can continue to build on it to make it better. Because ultimately, you know, we're building something that we want to work for them.
Yeah, absolutely. I love getting feedback from Bloomful patients. Like, I've had feedback that's brought a tear to my eye, quite honestly. And just knowing that what we're doing is working, that we are supporting people in the right way. You know, we've had users being like, I would be lost if it wasn't for you. And it, you know, it's just really great because it just shows that there is a problem there that we're solving, a real problem that we're solving. Have we identified specifically, you know, the absolute, you know, bottom line, one and only best way of solving it yet? The answer is probably no. We're still in a phase of really figuring out what our product looks like and how we can apply that to all women. But we are making really great strides towards that, and that's just really, really exciting. So, yeah.
Yeah, I'm super excited for what you guys are building. I think it's fantastic. And like I said, I know so many people for whom I would recommend that service. So, I mean, I think it's great. And I have no doubt that you guys are going to build something amazing, or continue to build something amazing. It's pretty amazing as it is. But I think that's one of the best parts of the journey is actually you know, speaking to real consumers, real patients, real customers, and hearing, you know, that your service made a difference to them. And I think maybe that's just something about being a doctor as well. I think like we care about all of our patients. But when you get that feedback, you know, it reminds you, you know, why you went into the industry, and why you work so hard, or we work so hard at everything that you know we're trying to build. So it is really rewarding. It's a struggle. I mean, it's a roller coaster, ups and downs, but it is 100% worth it. And yeah, I wouldn't change it for the world.
Cool, amazing.
Yeah.
Well, I'd love to be able to Bloomful a little bit at the end here.
Yes, tell us.
Tell people a little bit more. So, essentially at Bloomful, we're building patient-facing, women-facing platform, which helps women to access 24/7 chat and video-based support for their gynecological health. We're still early in our journey, but things are super exciting, and it would be just great for everyone here to maybe go on our website, bloomful.io. I'd love people to put their name down for our watch list, our wait list, and just receive updates on how we're doing and when we're launching. You know, as you've alluded to, I think this is a product that can help so many women to understand more about their gynecological health and to access a gynecologist so much easier than you currently can in our, you know, our current pathways. And, you know, it'd be just great to see you supporting Bloomful in that way, and just getting on board with what we're doing. So that would be great. The other thing is that we are doing one-to-one sessions, 20, 30-minute consultations with women who are currently, you know, going through particular things, have concerns, want to talk about their women's health journey. Anyone who has a story to tell, really, we'd love to speak to you. You can click on our website and schedule an appointment straight away. And it just gives us an opportunity to understand more about our customer, understand more about women, their needs, and really to help give reassurance, signposting, and advice, and also see how Bloomful could help you in your journey. So that's a free service, and yeah, we'd love to see people booking into that. And finally, our Instagram is probably where we're becoming most active. Up till now, it hasn't been the most active area, but we've just taken on an amazing content lead, Astrid, who is just brilliant, and we're going to be dropping lots of great content over the next few weeks and months. So follow us on Instagram, also LinkedIn, and yeah, it'd be great to have some of these viewers follow our journey and support us as a business.
Yes, absolutely. Well, I'm going to follow you. I'm going to check out the Insta. That's amazing. Yeah, absolutely. And so same goes for Yoxly. So check us out on www.yoxly.com. You can follow our Instagram. So it's at Yoxly Health. We're on Twitter. We just started a TikTok as well. Yeah, definitely. Yeah, I know. I've been dying to get on TikTok. I've been dying. So... So we're doing our best to make TikTok work, but absolutely. So at Yoxly, at Yoxly, you can purchase any of our 4 at-home STI test kits. If you have any strong feelings about sexual health care, if you've had a great experience, a poor experience with, you know, another service, our service, questions, concerns, we'd love to hear them. So you can reach out to us at info@yoxly.com, but we're always looking to get feedback. And just kind of connect with people, because ultimately, you know, we're building the service to serve, you know, real people, not just bottom lines. And so, in order for us to build it and meet the needs of our users, you know, we just need to have an open line of communication. So we are always happy to listen and learn. Yeah,
I'll be following you.
Oh, thanks, Dupe. Thanks. Yeah, I'll follow you too.